Cholesterol eyelids. Xanthelasma, also known as Xanthelasma palpebra, is a well-defined, flat, slightly raised and elevated, yellowish growth that typically occurs on the eyelids. It consists of cholesterol deposits that accumulate under the skin, and there is usually no obvious clinical diagnosis, but it is often mistaken for an ulceration. Even if cholesterol levels are normal, some individuals get xanthelasma, and it can even be a sign of a more serious condition, such as ulcerative colitis or ulcers on the skin. It is also possible that there is a genetic predisposition to the disease in the form of high cholesterol or high blood pressure, experts say, but this is rare. Small studies suggest that about half of all patients with xanthomas and xanthelasma have elevated levels of fat, which are often associated with hereditary heart disease, stroke, diabetes, or other cardiovascular diseases. Cholesterol is a fatty substance known as a lipid, which is mainly produced by the liver, but is also found in food. It is vital for the body's normal function and is caused by high cholesterol. Cholesterol eyelids treatment. There are medical treatments to lower cholesterol and reduce the potential for the expansion of issues related to high cholesterol, and surgical treatments can remove or bypass cholesterol plaques when they are that large that they start to impose on the client's eyesight. Early detection and treatment of high cholesterol can help to prevent potentially blinding, life-threatening and otherwise visually impaired diseases. Although it is not harmful, this skin condition should not be ignored and investigated by your doctor. Although it is not harmful, it should not be overlooked. It can cause serious side effects such as headaches, nausea, vomiting, dizziness and nausea. Xanthelasma does not affect the person's vision, so treatment is necessary. That is initially. If left to grow out of hand, the xanthelasma will need surgical intervention, but most people intervene before it gets to this stage. Removal with Xanthel registered is one of the recommended approaches to treating and removing your xanthelasma plaques. This treatment will also stop the plaques returning to the area. Defining cholesterol eyelid plaques. Cholesterol eyelid deposits can be a signal that there are ongoing issues with your metabolism. They can be a precursor to hidden health issues, such as the buildup of plaques in your arteries. The narrowing and hardening of the blood vessels cause an increase in blood pressure and hypertension. This increases the risk of heart attack and stroke, as the fatty plaques are broken down and completely block blood flow and cause heart disease. To prevent this, take the necessary steps to control your blood fats and have your cholesterol checked. Most people with xanthelasma have high cholesterol and fat levels that could put them at risk for heart disease, stroke or other heart problems. Many people do not know that they have higher cholesterol, even if they have it. Get your bloods checked by the doctor and if needed, start to take medicine to get your metabolism right again. When it comes to your cholesterol eyelids, to remove these, utilize Xanthel, which will remove them so they don't return again. Explore more options at xanthelasmatreatment.com or xanthel.com.